day everyone. Today we'll be assessing the muscular system, and this assessment refers to the method used by healthcare professionals to evaluate the integrity and function of the musculoskeletal system. This includes by examining the bones, muscle, joints, and associated soft tissues. And we have the objective. So objective is to evaluate the integrity and function of the muscular system. And next objective is to examine the bones, muscle, joints, and other tissues. And third is to assess the structure of the muscular system. So safety and security measure, we have the hand hygiene. Second is proper equipments or tools, if we have. And third is proper body mechanics. And we have the pre-procedure preparation. So first is wash hands, introduce yourself to the client and identify the client's identity, and explain what you are going to do and why it is necessary and how can client cooperate, and gather the necessary equipments and provide privacy. So first is, good morning sir. Ako na si Anthony Ella, sir. I will be your student nurse for today's shift, sir. So, mag-ask ko, sir, if kung sa yung pangalan, sir.
I'm Clark Ambinala, sir.
Okay, Sir Clark. So, Sir Clark, karon is mag-assess ko sa yung musculoskeletal system, sir. So, bali, sir, is mag-follow na ka sa akong mga instructions, sir. Pagsaba lang na if na kayo mga discomfort kang mabatian, sir. Inquire if the client has any history of the following. First is muscle pain, onset, location, characteristic, associated phenomena, and aggravation and elevation factors, and any limitation to movement, inability to perform activities or daily living, previous sports injuries, and any loss of function without pain. So first, sir, before ko mag-assess sa inyong muscular system, sir, is tanong kayo pang kasi mga sir, nakabati ba sakit sa inyong kalawasan, sir?
Wala, sir.
Kanang, dapat kayo ka-experience na kanang mga limitations sa yung movement, kanang mag-isog kaglakaw, mag-isog kanang lihok-lihok?
Wala, sir.
And last question, sir, is kanang, dapat kayo mga previous mga sports injuries, sir?
Wala po, sir.
Okay, sir, so. And last one, sir, is kanang na ba kayo mga function na kanang hindi ka kalihok pero wala sakit?
Wala po.
Okay, sir, so mag-proceed na sa atong assessment, sir. So now, we will be assessing the muscles. So, sir, good morning. Kanang mag-assess na ako po at sugod sa yung muscles, sir. So first is ako sa i-inspect yung muscles sa size, sir, ha? Okay, sir. Sir. So, okay lang ang muscle ni sir. So, next step is compare each muscle on one side of the body to the other side. For apparently distance measure to the muscle with the tape. So, we don't have a tape. So, let's just measure it by watching. And number 4, inspect the muscle and tendons for contraction. Inspect the muscle for tremors. So, sir, may-inspect ko sa mga pants ko, so mga muscle contraction. Yan na yung muscle, sir. Okay, sir. Sir. Then, next, sir, is yan na yung kamot. Okay, very good, sir. So, wala rin kayo nakita ng mga tremors and normal ang yung contraction. So let's proceed to the step number 6. Inspect the tremors and hands by the arm and having the client to hold arms out from the body. And step number 7, palpate muscle at rest to determine muscle tonicity. Palpate muscle while the client is active and passive for flaccidity and spasticity and smoothness of movement. Test muscle strength, compare the right side with the left side. So, sir, sugod mo palpate sa inyong muscles, sir, para ma-determine ako if na ba yung mga abnormalities, sir. So the same arm, sir. Next, sir.
Wala. Wala.
Kani, sir.
Wala.
Kani, sir. So the client didn't react to our palpation, which means there are no abnormalities. So let's proceed to the next step. So palpate muscle of the client when active. So sir, kanya ko barog sir, and ilihok yung mga muscle sir anak. Next. Wala sakit sir. So the client didn't react to our palpation, which means there are no abnormalities. So let's test the muscle strength and compare the right side and the left side. So palihog ko ka ng lingi diri sir. Lingi. While pangusog diri lingi sir, while gina-push na ko imong ano. Okay. Then bigas agad sir. Okay, very good sir. Then lift imong shoulder sir. Lift. Okay. Then i-push ang akong kamot sir. Okay, very good sir. Then sa tiil sir. Yes. I-lift imong tiil while ginapog na ako. Okay, thank you sir. Then, so and next sir is kanang pangusog umay sir, biraha ang kamot. Biraha pa pataas. Okay, pikas na po sir. So the client's muscle is normal. The client can move it freely and without any complaints. So overall, the client's muscle is normal. The next procedure is the bones. Inspect the skeleton for normal structure and deformities. Palpate the bones to locate any areas of edema or tenderness. So first is, sir, palihog ko straight tan-aw sir, kaya inspect na ko yung mga kabukuran, kabukugan. So yung sir. Okay ra? So sir, magsugod na kong palpate sa inyong bukog sir. So pagsaba lang if na kayo batian ng sakit. Ano sir? Skeleton sir. Ano sir? Hindi. Yung dili sa tail sir. So the client didn't react to our palpation, which means there are no edema or tenderness, and the client is unresponsive, which means the findings to the bone is normal. So let's proceed to the next procedure. So the next procedure is the joints. So first is inspect the joint for swelling. Next is palpate joint for tenderness, smoothness of movement, swelling, crepitation, and presence of nodules. And 14, assess joint range of motion. Ask the client to move select body parts if available. Use a genometer to measure the angle and joints in degrees. So sir is karon sir ako nag-test nimo sir yung mga joints sir. So mag-inspect lang sa imong mga joints sir. Ano may mga hubag-hubag? Wala kayo pang buhat ng mga activity karon sir?
Wala. Ayun.
So sir, okay ra imong joints sir, wala ko nakita ang mga edema or swelling sir or any abnormality. So kung palpate na kung sugod sir ha. So kung sir, may sakit sir?
Wala.
Hindi sir.
Wala.
Ano sir? Dali sir.
Wala.
So the client didn't react to our palpation, which means there are no abnormalities. So let's proceed and assessing the range of motion. So sir, paano kung barog, paano kung paano sa taas sir? Paano sa taas, then paano sa ubos? Okay, very good sir. So, and next sir is palihog kung ano sa imong kamot sir? May ubos. Okay, very good sir. Then next sir is ana-ana yung kamot sir? Wala rin sakit kung imong liyokon sir? Then, bali na po sir kung paano po. Wala rin sakit sir?
Wala.
Okay, very good sir. Then, ano na po din na sir? And yan po siya circle. And bali na po sir. Wala rin sakit sir. Then, next sir is imong isa ka diri. So, okay na sir?
Yeah.
Wala sakit. And ang pikas na po na to sir. Okay sir. Yan sir is kanang yan ang kamot sir. Wala rin sakit sir. And pwede kung barog lang dayan sir para masasapin mo sa ubos. Maana mo yung mga tiin sir. Okay, very good sir. And pikas na po sir. Then next, yung sir is yan na imong tiin. Yan na siya. Pikas na po sir. Wala respect kung imong iliyok sir. And last one sir is makaana ka sir. Anak pa sideways. Wala rin sakit sir. Pikas na sir. So, yun na, pwede na kami lingkod sir. So overall, the client didn't verbalize that he felt pain during the assessment of the range of motion, which means there are no abnormalities. We don't have the equipment to measure the range of motion, but overall the client's assessment is normal. That's all. Thank you.
And thank you, sir.